World Health Organization that have been working with us, with the Ministry of Health, the National Public Health Institute. We serve as the technical coordinator of the One Health program, partnering with agriculture, FDA, FAO, and our partners. Thanks to USAID for the support. Thanks to the USCDC, FAO, the World Bank, Eco Alliance, and other NGOs we've been working with. So trust me, you will sit in your seats and enjoy a very powerful program as we put One Health into action in Liberia. Thank you.
Other distinguished members of the government of Liberia, our fellow partners working in the health sector, and my embassy colleagues. First of all, let me thank you for interrupting the flow of the speeches so that I could do this at this point. So thank you for this opportunity to celebrate this important occasion in Liberia, World One Health Day. Let me begin with a few remarks on why this meeting is so important from the international policy perspective. In the wake of global pandemic threats, the Group of 7 nations endorsed the Global Health Security Agenda in June 2014. Since then, the progress has been steady. As of May 2018, the Global Health Security Agenda has 65 member nations, including Liberia and the United States, all of whom are formally committed to global health security. The United States treats the global fight against infectious diseases and pandemic threats as a priority on its national security agenda. In fact, just last month, the United States renewed its commitment to the global undertaking against infectious disease at the ministerial in Indonesia. At that meeting, in which Liberia was represented by its ministries of agriculture and health, the U.S. committed an additional $150 million through 2024 to the global effort. This is in addition to the already $1 billion worldwide the U.S. has already committed to this effort. This commitment by the United States reflects a basic fact. Borders do not stop the spread of disease. National regulations, law enforcement initiatives, and stovepipe approaches provide no effective containment against diseases. Therefore, the concept of One Health, that animal and human health are inextricably linked and becoming jointly established. Recent global disease events have underpinned the increasing impact of zoonotic diseases on human and animal health. It is predicted that 75% of future pandemic threats will have a zoonotic origin. It has also become clear that population growth and climate change are drivers for the emergence of such diseases. This is why the U.S. government supported the creation of the One Health platform in Liberia over a year ago. And we are proud of what that partnership has achieved. Today, Liberia is the first country in West Africa to produce a One Health governance manual and a One Health strategy with a whole of government. Another striking example of One Health sponsored activities in Liberia is the recent renovation of the Central Veterinary Lab and the training of its staff. We'll continue to support the Global Health Security Agenda and One Health in Liberia. We are incredibly proud of our work with our Liberian partners and what that partnership has helped Liberia achieve in its fight against the spread of infectious diseases.
Here in the room to thank for that. As has been highlighted, this is something that cannot be done alone, whether it's at global level or at local level. And really appreciate the support that Asia has received from partners, from many of the donors, and also to all of the government my ministries, and in particular to the Ministry of Health and to our NFIeld colleagues. As was mentioned by DG earlier, Liberia really has come very far, as was shown last week with the Vice President advocating on behalf of Liberia in Ghana. And we're seeing such a good response. we also know through WHO and speaking to many of our other country offices how well the country is doing here. And that is thankful to the leadership that's being shown really by the Liberian people. And some of the other countries they haven't moved as far, even though they started much earlier because the political will hasn't been there. So we really want to acknowledge that. We also want to acknowledge all the hard work that's actually being done, both by the people at the national level and at county level across different sectors. Because as we know, you need to have a political will, you need to know what you're going to do, and then you need to be able to implement it. So that is also really to acknowledge all of the people that are the frontline workers that are working on this. And one area moving forward that we'll have to work even more on is really the implementation down at the county, district level, in the community.
With you to celebrate another World Health celebration in Liberia. I think this is not just a platform. We keep talking about it as a platform. To me, a platform is something that exists that people stand on. What we're really building in Liberia, and what has been built in Liberia, is a collaborative network of partners that work together to ensure that we prevent, detect, and respond to disease threats, and also maintain a level of preparedness and response. This was clearly illustrated last week when we had a chemical spill here in Liberia. That was led by EPA and the National Public Health Institute, and the response is still ongoing. But what did that mean? It meant that people in the chicken soup factory area were protected from the possible exposure to chemicals as toxic as chlorine gas. That's a living demonstration of what One Health is all about. Health is a collective responsibility and not the responsibility of no one person, no one agency, or no one nation. So CEC stands ready to continue our long-standing support of the One Health platform through support for surveillance activities here in Liberia, laboratory strengthening and setting up bacteriology labs in 3 locations right now, at the National Reference Lab, the Redemption Hospital, and the Tapida Hospital, where we can actually test for bacteria and also test which antibiotics they're responsive to. That's a major step forward for Liberia. Many other African countries do not have that capability. We've also been engaged in helping the government of Liberia develop a strong, robust public health workforce, and we'll continue in that effort, and also continue to partner with the government of Liberia, especially the National Public Health Institute, in emergency management and response. All of this is good, but we also need to support that with infection prevention and control. Some of you who've been here for a while know that I'm always excited about IPC. I'm still excited about IPC because it's the way in which we protect our own workforce. We met with about 22 generals and high-ranking military officials at the APOA meeting last week to talk about the intersection between the military and the civilian authorities in protecting workforce and protecting their nations. And one of the things that came out very strongly from that is the need for all of us to work together. So I looked around the room today and I looked at someone, but I thought to myself, we don't have any EFL people in this room. I think that's an oversight that we can easily correct. They need to be included in these discussions because there will come a time when we will need their support in responding to some of these outbreaks. But at that meeting, it was also very important for us to discuss how we all can come together to provide a strong security blanket for Liberia. And I know that they stand ready to support us. Most of the work that we do here in Liberia, and a number of the partners here in district, are focused on human health. And if you look at the joint external evaluation scores for the global health security and agenda in Liberia, you would see that the scores for human health is significantly higher than the scores for animal health. We stand ready to, with other partners, help the animal sector in Liberia transfer some of the knowledge, skills, and experience that we've already developed for the human sector to the animal sector to make sure that we bring up the whole platform to protect Liberia from disease threats. So with that, I want to congratulate you again on the celebration of the 3rd One Health International Partners Day, and I want to congratulate Son Conscient especially for being the fearless leader of this platform in Liberia.
Amen.
So let's join to begin with the report as a whole, looking for
partners, all stakeholders, all protocol observers. I'm doing this opening remark on behalf of the Food and Agriculture Representative, Mr. Maya DJ. I'm really pleased to be here, to be part of this day of celebrating the One Health Day, which is in fact celebrated for the third time. I don't know, maybe that's the third time in Liberia, but it is also the third time internationally to be celebrated all over the world. So One Health Day is an international campaign celebrated worldwide for the first time on November 3. In fact, we did it on November 23 for various reasons. And initiated by three One Health groups, the One Health Commission, the One Health Initiative, and the One Health Platform Foundation. And the One Health Day is aimed at bringing attention around the world on the importance of One Health interaction and collaboration among among multi-sectoral, multidisciplinary professionals that span animal, human, animal, and environmental health. Emphasizes on the urgent need for One Health's transdisciplinary, multi-sectoral approach toward solving today's critical global health challenge and advocates mitigating the impact of emerging or re-emerging zoonotic infectious diseases, antimicrobial resistance, climate change, environmental pollution, food safety, and many other cross-cutting problems through a holistic way of doing business. As it has been mentioned by others, all these issues cannot be solved by any single entity. And then unless and otherwise we see things and we work together, then we cannot be able to avert future pandemics that may affect or that will be the threat for the world. That's why we come together to celebrate this One Health. That's why we come together to advocate for the One Health approach. So One Health approach is an effective way to address complex public health stress, especially those due to emerging disease, before they spill over to human beings. And as you may know, countries continue to face health security threats by infectious disease, whether naturally occurring, deliberate, or accidental. Recent infectious disease outbreaks with pandemic potentials like Ebola, Lassa, Zika, mosquito, plague, influenza are reminders of the significance of this threat and the range of gaps in capabilities to prevent, detect, and respond in countries worldwide. Disease crisis can destabilize government by eroding public trust and confidence, posing a threat to public order and governance, and producing an overall risk to security and economies. These are cross-sectoral challenges. For example, animal disease outbreak can threaten food security, disrupt local economies, lead to human disease outbreak, and erode social habits in vulnerable societies.
Yes. Thank you, sir. Thank you very much. So,
multi-sector collaborative effort to protect our environment. We are also happy that the issue of the environment is becoming more and more visible as events continue to occur. One of the speakers just spoke of a chemical spill recently, but there are many other incidents occurring around the country, not just one example. We have a TSF, a storage stealing facility being broken down, a zero concession area, chemicals of cyanide, mercury, and other stuff are being spilled into the environment, being spilled into wetland, contaminating wetland, contaminating the environment, and we need the effort of our colleagues from other land agencies to ensure that we address these issues. And that is why we are happy to be a part of this, and we'll continue to work very hard. We'll continue to make sure we make our presence felt. The executive director has informed me to inform all of our colleagues, and the EPA is committed. We know this issue of inadequate materials and other things across various sectors. But whatever we have, we tap into it as we continue the improvement to make sure that One Health succeeds for the angle of environmental health. Thank you very much.
Set up a confiscation unit, and we have intensified our effort. We are confiscating a lot of wildlife and wildlife pieces. Over the past 6 months, we confiscated 260 pieces of wildlife. We've confiscated 2 African sun eagles. We confiscated 2 tigers. We confiscated 1 pangolin, and we confiscated 1 calf or baby buffalo. Obviously, our staff who are working on the field in confiscating this wildlife or wildlife parks are coming in contact with wildlife. It's clear that if an eagle is healthy, it's not an easy task to capture that eagle. So for an eagle to be captured, it must have been suffering from some sort of a disease or so. And that was proven after the assessment. This means that our staff are most likely at risk in coming into contact with wildlife in the area. Again, not just our wildlife, but we do have full regional offices, and at those offices we do have the offices control close to the 6 national park or protected areas. Our rangers are in the field, they are in the bush, day and night, making sure that the area is protected. They are also coming in contact with wildlife, some of whom will be invested. So this is a challenge, it's also an opportunity for us. The FDA, we are also trying to expand our revenue base. 2 key activities that we are targeting: the ecotourism and setting up of wildlife impact. It is an obvious fact as a nation and as a people, we do not want to expose our tourists to health issues. So it's clear that we make sure that we work with the Ministry of Health to strengthen the surveillance system so that when our tourists are coming, whether for ecotourism or for hunting, they will be healthy animals, or where there are reports that this wildlife that there is some disease around there, they can be forewarned how to go to the areas. So we thank you very much for this invitation, and we should stress also the issue of human capacity development. Last time I checked, except my brother who is there, we do not have a wildlife vet, an Liberian wildlife vet in Liberia, except nobody can tell me that. So I'm encouraging our young people to go into that area, forget about the management and business and social science and something else, and go somewhere where your effort can help this country better than just sitting in office and working for the sake of getting paid. It's a challenge to you. It's a good area. We don't have many people in that area. At the Basa, where we have our sanctuary, the management normally send for 1 person at a time to manage our place. That person is an expatriate. So we calling on you to look in that direction. That is done, I think will be put into the nation across the park. Again, distinguished ladies and gentlemen, thank you for the invitation. Thank you for your support to our partners. Let us work together.
And we are always happy to be a partner of what Enfield is going as one of our close partners and close collaborators. Sometimes they say we honor people when they die, but I think the role of Enfield and its executive director cannot be overlooked. This program is on its feet because of his vitality, because of, in Liberia will say, hard work. And I want to praise him while he is alive. The platform is very important, especially when it comes, when we look at disaster. When disaster strikes, we have a lot of priority areas. And for each of these areas, there are health implications. And if this platform is not effective, then our disaster management program, our interventions will not be effective. So I want to thank this initiative, and I want to thank the partners for upholding and supporting this platform. It's very important as we also look at our global agenda. You know that taking care of health is very important because health really is affecting the whole. So all activities or all incidences that affect health also affects the whole. For the past, Lord, we had more than
Committee on Health, Gender, Children and Social Protection at the Liberian Senate. You know, as I listened to some of the remarks that were made, I was filled with pleasure that at long last, many of these partners are working together. Some time ago, when I served as Minister of Health of this country, it was so difficult to get many of these partners, especially from the line ministries, to sit at one table and deal with issues. Many times we have directors running behind other directors of other ministries, but thank God, with the establishment of this One Health platform, everybody have been brought to the table and are working together. As previously stated by many of the previous speakers, the One Health concept is a global strategy for expanding interdisciplinary collaboration and communication in all aspects of healthcare for human, animals, and the environment. It recognizes the fact that human health, animal health, and the ecosystem are inextricably linked. The One Health concept seeks to promote, improve, and defend the health and well-being of all species by enhancing cooperation, collaboration between physicians, veterinarians, and other scientific health and environmental professionals by promoting strength in leadership and management to achieve these goals. I remember when I was in medical school, had a joke. Our colleagues that were doing veterinary medicine, we always classified them as doing pseudo medicine. And they always told us that, look, we know more microbiology than you guys that are doing human medicine. And that statement is becoming more and more factual, especially as we see what is emerging around the world with diseases, emerging diseases, and other diseases that affect human beings. 60% of all human diseases originate in animals. And 75% of all re-emerging diseases are zoonotic diseases, that is, of animal origin. Many of the microorganisms that cause diseases, bacteria, viruses, fungi, and parasites, affect both animals and humans via the environment. To name a few, some of those were just said. Rabies, influenza, Rift Valley fever, dengue fever, and do not go too far, Ebola. Antibiotics resistance is also a growing threat to global health, because antibiotics are used for both humans and animal diseases. As the livestock industry expands, you know very well that, especially our country, Liberia, a lot of the food that we eat here are imported from other countries. We get most of our meat from other countries. And the livestock industry is as such that it uses hormones and antibiotics on a very wide scale just to be able to provide more food for a growing and expanding global population. The antibiotic resistance that we're talking about, most of it will originate in treatment of animals. And once that resistance takes place, it's easily transmitted to humans. You know, it is stated that mankind is moving closer and closer to the wildlife. If you unscrupulously prescribe antibiotics to people, you are making life even more difficult for you in the future. Because even in the hospitals, there are multiple drug resistance, especially for in-hospital infections. So the issue of antimicrobial resistance can only be sorted out, and we can make antibiotics more efficacious once we eliminate these pseudo prescriptions. For example, if you go now in Grand Coup, the country I'm from, you have the black bag doctors carrying it now. In fact, they are not using bags, they are carrying it in pockets. Prescribing not only the wrong antibiotics, but antibiotics that are outdated. And people use it, people buy these things, and people have confidence that they will get killed. But the bigger picture is that they are setting the stage for multiple drug resistance, to the point now that the Septrin and amoxicillin are no more treating typhoid fever. Typhoid, that is one of the most ubiquitous infection that affects people in our sub-region, is becoming resistant. Long before, you know very well, we were using chloramphenicol, and chloramphenicol got resistant. And now we are seeing, by virtue of our cultural sensitivities that have been done around, we are seeing more and more resistance emerging from the other antibiotics that are frequently used. And it is not only in our African setting. The Europeans have a problem with multiple resistance. The Asians have a problem with multiple resistance.